So you and your husband have had the talk. Your friends and family have been pressuring you for months, if not years, to carry on the family name. And you've been catching the baby fever from all of your girlfriends lately. For most, this is a very exciting time that also comes with a little bit of anxiety. Will I get pregnant? The first time? What about the third time? Will it take years? What if I can't get pregnant? All of these are reasonable questions that will go through your mind as you begin your journey to conceive. And rightfully so. This is a huge deal. While your body is really in control, there are some things you can do proactively to make sure that your body is in prime baby-making condition. I'm Krystal Hammett, certified nutritionist for Hotze Vitamins, and also a mom to my beautiful little girl. These are my top 9 ways to naturally boost fertility. There are 4 big areas I want to concentrate on when looking to improve fertility. That's diet, lifestyle, hormones, and nutritional supplementation. So let's jump right in. My first tip is my favorite: eat well. Nourishing your body with real whole foods can boost your chances to conceive. To ensure a regular menstrual cycle, be sure your diet is rich in protein, zinc, vitamin C, and vitamin D. Deficiencies in these nutrients can make a direct link to longer menstrual cycles, which means less frequent ovulation and even a higher risk of miscarriage. Some examples of high protein foods consist of meat, fish, eggs, beans, and even some dairy. Eat lots of fruits and vegetables. Dark leafy greens and tomatoes are very rich in vitamin C. Add nuts and beans to your diet. They're rich in zinc. And consume tuna and eggs, which are loaded with vitamin D. I always suggest that you have your vitamin D levels tested as well to make sure they're at optimal levels, and that you supplement accordingly with a high quality and potent vitamin D3 supplement. And here's the big one. Are you ready? Remove those grains and processed foods and sugar from your diet. Number 2 is stick with organic. Many pesticides and herbicides have been linked to fertility issues in both men and women. The March 2015 issue of Human Reproduction expressed that eating fruits and vegetables that contain pesticides can also affect sperm count and also the quality of sperm produced. These pesticides may also affect female fertility by disrupting the menstrual cycle. Bottom line is that if you're looking to get pregnant, stick with organic fruits and vegetables and be sure to carefully wash all produce before you eat it. This next step concerns a different type of toxin, alcohol. So think before you drink. Many studies have shown that alcohol can alter estrogen levels, which may interfere with conception. If you use alcohol to de-stress, try a natural stress reliever such as inositol. This wonderful supplement is naturally derived from vitamin B8 and is excellent for stress management. It turns off that brain chatter and those racing thoughts that lead to anxiety. It's great to take any time of day, but especially at night before bed. Additionally, caffeine can also reduce the chances of conceiving. So try to keep that coffee at a 1 to 2 cup maximum per day. For a natural energy boost, consider supplementing with Dr. Hotze's Energy Formula multivitamin or a B complex to boost your energy levels naturally. Another related topic to improving fertility is to reduce your exposure to environmental toxins. Experts today are discovering more and more links between environmental exposure and infertility. High levels of that BPA found in plastic, eating utensils, and canned goods create a toxic load in the body, and this can contribute to PCOS, which complicates fertility on its own, and it can also increase the risk of uterine cancer. Some studies have also shown a relation between endometriosis and environmental toxins, so avoid using pesticides on your own lawn, use natural organic personal care products, and always work in well-ventilated areas. Excess toxins in the body are also directly related to excess body weight because toxins are stored in body fat, which brings us to my next tip: watch your weight. Excess body fat can lead to an overproduction of certain hormones that disrupt ovulation. On the other hand, too little body fat can cause your body not to produce enough hormones to ovulate regularly or sustain a pregnancy. The best way to do this is to keep your weight within a healthy range by eating well and exercising regularly. Now on to tip number 6, stress a lot less. Sure, wanting to get pregnant can be stressful, but stress may actually put a damper on fertility. Too much stress can throw off your body's hormone production, causing inconsistent menstrual cycles. Use techniques such as yoga or meditation to help reduce stress naturally, or supplement with the natural stress-reducing mineral magnesium. Magnesium is very easily depleted in many ways, especially through stress, exercise, and caffeine, to name a few reasons. As we deplete magnesium, our body quickly goes to work to try to replenish what's lost. So if our stress levels get the best of us, that magnesium doesn't stand a chance to fully replenish to optimal levels, and a vicious cycle begins. So this is why supplementation is necessary. When we have stable magnesium levels, we are healthier in general and can better manage that daily stress. Now, tip number 7, know your cycle. A normal cycle should last anywhere from 21 to 35 days. But if you're having longer cycles, this means less ovulation and a cause to speak to your healthcare provider. In addition to knowing the correct length of your menstrual cycle, you also need to be aware of when you are ovulating. A woman's most fertile days are typically the day of ovulation and the 4 to 5 days before, not after. However, everyone's ovulation window can be different. To know when you're ovulating, urine or saliva-based ovulation test kits are available over the counter. These tests simply check for the presence of hormones that show ovulation is impending. My next step is ditch the oral contraceptives. Not only are these false hormones detrimental to your health and a promoter of breast cancer, but they also delay pregnancy. Because of the hormones put off, oral contraceptives should be stopped several months before trying to conceive, if not sooner. Getting off of oral birth control pills gets your body into its own natural rhythm, which gives you the opportunity to track your period and learn your ovulation times. Now let's talk about supplements. So we talked about supplementing with Dr. Hotze's Energy Formula Multivitamin and B Complex and the all-important vitamin D3 and magnesium. But we also need to talk about boosting your folate. Having sufficient folate levels in your body can help reduce the chances of your baby developing birth defects. Additionally, folate helps cell division and promotes ovulation. Most prenatal vitamins do not meet your daily folate needs, so it is essential that you take a folate supplement that is not only the correct dosage, but also the correct form. A simple folic acid supplement is not enough. Active folate is the most bioavailable, highly absorbable folate on the market, and 1,000 micrograms should be taken daily at least 3 months before trying to have a baby, through the pregnancy, and while breastfeeding. There are also a few other natural supplements and herbs that I strongly recommend to help boost fertility. These are fish oil, maca root, vitex or chaseberry, progesterone, and zinc. I'm going to dive into each one. Cod liver oil or fish oil provides DHA and EPA, which are 2 acids that are extremely healthy for the body and aid in promoting regular ovulation and supporting sperm production, so great for both men and women. Maca root is a hormone balancing herb that helps increase both libido and fertility in both men and women as well. Now, vitex chaseberry is an herb that nourishes the pituitary gland and helps lower prolactin to increase progesterone and improve fertility. And zinc. Without it, your cells cannot divide properly and your estrogen and progesterone levels can get out of balance and interfere with your reproductive system. And perhaps more importantly, men do need to take zinc as well to boost those sperm levels and improve the function and quality of the sperm. And lastly, progesterone. Infertility can most often be linked to specific hormone imbalances, and many times progesterone can be the issue. If you're a guest of our Health and Wellness Center, talk to your provider about your progesterone levels and make sure to let them know that you're trying to conceive. If you're not yet a guest of our Wellness Center, Progesta-Fem Progesterone Cream is an over-the-counter blend of herbs that mimic and help increase progesterone production naturally. I truly hope all of this information is helpful for you. If you have any questions, please feel free to call me directly at 281-646-1659. And once you do become pregnant, be sure to give me a call so that we can get you on our premier pregnancy protocol to make sure you and that little one are getting all the proper nutrients needed. To receive all of this information in my most recent white paper, Natural Steps to Conceive, complete the form below and it'll be emailed to you directly. Thank you so much for your time today. I wish you and your spouse the best of luck on your journey to start having a family.